I can't imagine accidentally operating on the wrong foot. As a surgeon, this is a thought that keeps me up at night, and I'm sure it's a concern for patients too. I'm Houston podiatrist Dr. Andrew Schneider. I'm board certified with over 20 years of experience. Thankfully, there are tried and tested strategies that have been developed to ensure that such errors are minimized. In this video, I'll discuss the various processes and protocols that I personally follow to make sure that my patients never have to worry about becoming a surgical horror story. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. If you've been following the news in Houston, you may have seen a story about a podiatrist who operated on the wrong foot. In this recent case, the patient had the need for surgery on both feet, so even though the wrong foot was operated on, there still was a need for the surgery. Tragically, there are stories I hear about the wrong foot being amputated. There's no coming back from that, unfortunately. From the preoperative verification process to the implementation of a timeout protocol, there are steps that are crucial in ensuring that my surgical team and I are always on the same page, with the patient safety being our priority. Moreover, effective communication and continuous education are essential in keeping us all sharp and focused on our task at hand. So sit back and let me walk you through the steps I take to guarantee that I never, ever operate on the wrong foot. You'll find that the preoperative verification process is a crucial step in making sure you don't end up operating on the wrong foot. This process involves several checks and verifications before the actual surgery takes place. It starts actually in the preoperative area, where the patient provides written consent, which must be clear and include the details of the procedure being performed, specifically mentioning the side of the body to be operated on. It's signed by you as the patient, as well as by me as the surgeon. Next, we conduct a preoperative assessment, which includes reviewing the patient's medical history, previous surgeries, and any potential risks. During this assessment, the surgical site is also clearly marked with an indelible marker to ensure there's no confusion in the operating room. As the surgeon, I personally mark the foot to be operated on. Marking the surgical site ensures I don't mistakenly work on the incorrect foot. This crucial step involves physically marking the foot that will be operated on with a permanent marker, usually by writing yes or drawing an arrow pointing to the correct surgical site. Personally, I draw a happy face on the correct foot and I sign my initials. This mark must be clearly visible to all members of the surgical team and should be done while the patient is still awake and able to confirm its accuracy. Furthermore, the mark should not be easily removed during the surgical disinfection prep or covered by surgical drapes. This simple yet effective method is an essential part of my protocol to avoid operating on the wrong foot. In addition to marking the surgical site, I also involve the patient in this process to ensure their understanding and agreement. Before making the mark, I confirm with the patient which foot is being operated on, and I ask them to verify the marking placement after it's done. This extra level of engagement not only offers reassurance to the patient, but also serves as an added safeguard against potential errors. By combining the patient's involvement and clear visible marking, I can successfully minimize the risk of operating on the wrong foot. Another essential aspect of the preoperative verification process is the timeout procedure. This is a final safety check conducted in the operating room just before the surgery starts. The entire surgical team participates in this timeout. Everyone stops what they're doing to participate. During the timeout, we confirm the patient's identity, the surgical procedure to be performed, and the correct surgical site. Any discrepancies or uncertainties must be resolved before proceeding with the surgery. This timeout procedure is a vital safeguard against operating on the wrong foot and is strictly followed by surgical teams worldwide. During this timeout, every surgical team member must actively participate in confirming the details, ensuring that everyone is on the same page and aware of their responsibilities. In addition to improving overall patient safety, implementing a timeout protocol also encourages a culture of open communication and teamwork. within the surgical team. This environment encourages team members to voice any concern or discrepancies they might notice, further reducing the likelihood of mistakes. By consistently implementing a timeout protocol, I can ensure that my surgical team and I are always attentive and accurate, preventing errors like operating on the wrong foot. Establishing clear and open channels of communication within the surgical team is like weaving a safety net that catches potential errors before they escalate, ensuring precision and fostering a collaborative atmosphere throughout the procedure. This includes creating a culture where every team member feels empowered to voice their concerns, ask questions, and clarify information without fear of retribution or judgment. Regular briefings and debriefings, as well as encouraging active participation from all members of the team, can contribute to this environment. By cultivating a strong foundation of open communication and safety protocols, surgical teams can work together more effectively to prevent errors, such as operating on the wrong foot, and ultimately enhance patient care. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're planning on having foot surgery, you can ask your surgeon what he or she does to prevent surgical errors, such as operating on the wrong foot. If you need a surgical consultation or a second opinion, feel free to contact my office for an appointment. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.